Are you a dentist who is a great practice manager, but with team turnover gets tired of training new team members? Or do you manage a DSO and are looking for ways to delegate more to more people? Are your biggest strengths your clinical skills, but no, you need more training in the business of dentistry? Or are you new to the profession of dentistry and need to learn more of what your team members are talking about? If so, then this course is for you. Before I even start consulting a practice, I look at certain metrics to find out several things. And I'll discuss those metrics and good benchmarks for those metrics in this video. The solutions, however, to low metrics are in the courses that follow. Today, I want you to get a handle on what to look for and where you currently stand. The very first thing I look at is, do you have the right amount of providers? And second thing is, what are some opportunities for growth you might be missing out on in the practice? Before we can even get into the details of those two things, I hope you have a real-time metrics dashboard. It's 2019 and there are several out there, and I'll list a link to my favorite below. You just don't have time to run reports constantly. You and your team need these numbers at your fingertips daily. Send me an email if you have any questions about a dashboard. Now let's get into the details of some of those metrics. Okay, let's start with number one. Do you have the right amount of providers? To find out if you have the right amount of providers, follow these steps. First, find the size of your practice. How many active patients are there? I like to base this on how many patients have been in the last 12 months. Second, do you have the right amount of dentists and hygienists? Now that you know the active patients, let's see if you have the right number of hygienists. Let's say your practice has 2,000 patients. Of those 2,000 patients, most need 2 hygiene appointments per year, equaling 4,000 hygiene appointments needed. Now, no dentist has 100% of their patients stay in the practice or show up, but a good patient retention rate is 85%. So we'll use that. 4,000 hygiene appointments times 85% retention equals 3,400 hygiene appointments needed per year. 283 appointments per month and 70 per week. In a 4-day work week, that's 17 hygiene appointments needed per day. Because a hygienist usually only sees 8 patients per day, this tells me the practice needs 2 columns of hygiene booked each day. Third, use your active patient number to determine how many doctors are needed. If there are 1,500 to 2,500 patients, an associate could be needed for a 1-doctor practice. Most important thing is, if you're booked out 4 to 6 weeks, you probably need an associate. Okay, let's look for opportunities for growth in the practice. I'll start by pulling an average number of new patients per month. A practice can't thrive without a constant flow of new patients. A good benchmark would be about 25 to 30 per doctor. I found that not many doctors like to do more than 2 a day, but really that depends on how much of a new patient experience the doctor is willing to delegate to their team members. If the new patient is lower than 25, I look at opportunities for internal and external marketing. I would then move on to evaluate all the systems in the office so that the external marketing dollars spent don't go to waste. There is no point in spending marketing dollars if the patients don't have a good experience and then they leave. My other courses will cover all the systems needed so that marketing is in a good investment. Next, I'll move on to gross and net production, write-offs, and collection as a total for the year, month, and days and hours. A good production benchmark I use is about 25,000 of production per op per month. If it's low, the space might be too big, or I wonder if they're offering enough services to their patients for optimal oral health. There are a lot of options to maximizing space and a lot of oral health solutions to offer patients that every provider can use depending on your philosophy and that we will cover throughout the course, like increasing case acceptance and case average. Once you have those metrics, I get specific and look at doctors' production. If there are more than 1 doctor, I look at each of their production collectively and separately. Doctor production should be close to 70% of total production. This can be affected if the practice is in a rural area or, on the opposite end of the spectrum, a high socioeconomical area, but really not by much. If doctor production is lower than 70%, I immediately look at unscheduled treatment plans. I have found anywhere from $100,000 to $1 million of diagnosed treatment that hasn't been scheduled. If this is the case, the doctor's case presentation is the first place I look. Why aren't patients scheduling? In several DIY courses, we discuss patient flow, diagnostic tools, doctor case presentation, scheduling, and multiple options for financial arrangements. All of these must function well together to get patients to schedule. Next up is hygiene production. First, I look at hygienists' monthly, daily, and hourly average and compare it to how much they're paid and how they are paid to ensure that the hygienist department isn't costing the practice money, which is actually more common than you would think, and the owners have no idea. Hygiene should be around 30% of total production. If it's not, two things I check are fluoride and perio case acceptance. I like to see fluoride case acceptance at 85% and case acceptance in perio between 20 and 30% of a hygienist's total production. If needed, I'll also look at x-ray protocol, how many sealants are offered and done, whitening procedures. There are lots of procedures to offer in the hygiene department other than just prophies. If hygiene is below 30% of your practice production, check out the hygiene efficiencies class. If it's more than 30%, I'm going to go back and double check the doctor's case diagnosis and case presentation systems. Next, I figure out churn rate, or patient retention. Churn rate is the percentage of patients who leave the practice. Churn will help you find out if your continuing care service and team members need additional help reappointing patients or not. Or maybe you have a customer service problem. Similar to unscheduled treatment, there are many systems that need to be looked at as why patients leave. If you don't have a dashboard, there are some reports you can run to find out your churn rate. For example, run a procedure code report for the last 12 months and total the number of 1110s, 1120s, and 4910s. Let's say the number is 3,200. Divide that by the 4,000 appointments needed that we talked about. You get 80% retention or 20% churn. Ideally, we want churn closer to 10 to 15%. If churn rate is really high, I look at patient surveys. I hope you have a good survey system in place. Patients are your best R&D or research and development. They will tell you where you need to improve. Also, make sure you provide a good product. I plead with my clients to have a good lab. If the lab is subpar, especially in cosmetics, it reflects on you and your practice, not the lab. If you're not incredibly confident in your product and your clinical skills, invest in a good clinical course. There's always something new to learn and improve on. I will cover more about churn and how to lower your churn rate in the marketing section. New patient retention is another metric I look at. If you don't have a dashboard, look over the last 6 months and find out how many comp exams were done. Then find out how many have a scheduled appointment. If at least 80% of those comp exams didn't become scheduled appointments, I'm going to look at what the new patient process is, because it's not working. In my new patient experience section, I discuss the entire patient flow and everything that needs to happen so no one fumbles the ball during the new patient experience. Then I'll go look at broken appointments and no-shows. If the practice averages 1 broken appointment or no-show per day and averages $200 per hygiene appointment, times that by 4 days a week, times 50 weeks a year, that's $40,000 in lost production. I then look at phone calls missed, your phone call scripts, and frequency of contact with the patient as possible ways to prevent missed appointments. Our admin training section covers ways to decrease no-shows and cancellations. So before you invest more dollars into marketing for new patients, evaluate the basic metrics of your practice to see what systems might be a little off track, and then just course correct using a few of my solutions. New patients can be a great way to grow the practice, but all of those marketing dollars will go to waste if you can't capitalize on the people when they show up. You are off to a great start as a DIY practice management expert. You now know how to find baseline metrics and what systems to address if the practice isn't where you'd like it to be. Make sure you look at these numbers often.